Hello everybody, my name is Nida Sayed and today I'll be talking about attention deficit hyperactivity disorder, also known as ADHD. So, today in my presentation I'll be discussing what is ADHD, type of ADHD, causes and symptoms and implications of ADHD, early intervention and inclusion teaching strategies, strategies for management of behavior needs in early childhood and classroom settings, types of environment and learning experiences suited for children with ADHD. So, what is ADHD? ADHD is one of the most common neurodevelopment disorder of children, and it is usually diagnosed in early years and often lasts into adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behavior, or may act without thinking about what the result would be, or be overly active. So, there are three different types of ADHD. The first one is inattentive type, second one is hyperactive impulsive type, and the third one is a combined type. So, what is inactive type? In an inactive type, for children with ADHD, it is hard for individual to organize or finish a task, to pay attention to details, or to follow instruction or conversation. The person is easily distracted or forgets details or daily routines. Person who is suffering for hyperactive impulsive type is very frigid, talks a lot, and has very hard time sitting still in a place for a very long time. Um, Children may run, jump around, or climb constantly. The individual feels restless and has trouble with impulsivity. Some who is impulsive may interrupt others a lot and grab things from people and speak to them in inappropriate ways or speaks too loudly. And the third one, and which is the most common one, is the combined type. It has symptoms of both the above two types of equally present in a person. Causes of ADHD. Scientists are studying the causes and the risk factors in the effort to find the better way to manage and reduce the chances of ADHD. The causes and the risk factors of ADHD are unknown, but the current research shows that genetics plays a very important role in ADHD. People, parents who are having ADHD or any sort of mental disorder may pass on the gene to their children and they might suffer from ADHD as well. Children with brain injury are more likely to have ADHD. Children who are exposed to harmful environment during the time of pregnancy or at a very young age. Mothers who are involved in drinking alcohol, taking tobacco, using drugs during the time of pregnancy may cause ADHD to their children. Premature delivery and low birth weights are also the causes of ADHD. Do you know boys are on a higher risk of having ADHD than girls? Parents who are having ADHD, their children are at a risk of 25% to get ADHD. So the symptoms of inactive types. So there is some DSM-5 criteria for ADHD. It states that 6 or more symptoms of inattentive type for children up to the age of 16 or 5 or more for adolescents or older or adults needs to establish the diagnosis. Symptoms of inattentive type should be present for 6 months and they should be classified by a doctor, a specialist. So let's go through some classic symptoms of inattentive type. Children fail to pay close attention to details or make careless mistakes in schoolwork. Have trouble staying focused in tasks or plays. appears not to listen even when spoken to directly, have difficulty following through on instruction, and fail to finish homework or chores, have trouble organizing tasks and activities, avoid or dislike tasks that requires focus, materials, or efforts such as homework. Loses items which are needed at the time of activities, for example, toys, assessment, pencils, eraser. The children with inattentive type get very easily distracted. They cannot stay focused at one thing. They tend to forget things easily. The second one is the symptoms of hyperactive and impulsivity. Um, just like inattentive deficiency, DSM-5 state that six and more symptoms of hyperactive and impulsivity for children for the age of up to the age of 16 or 5 or more for the up to the age of 17 or adult should be should be have to diagnose the hyperactive impulsive disorder. So let's go through some of the classic examples and symptoms. uh, Children are very rigid, and they tend to tap their hands or feet on the floor. They cannot sit at one place for a very long time, have difficulty staying or being in a classroom, uh, be on the go, in constant move. They can't stay. They keep running around, jumping around, climbing around. Runner have a difficulty paying or performing an operation softly. Speaks far too much. They talk too much. Having a trouble time waiting for his or her turn. Interrupts or intervene with with discussion and sports or actions of others. The implications of ADHD on children. Children with ADHD face increased difficulty in school, having higher risk of school expulsion or dropouts or academic underperformance. Socially, they have to struggle with both peers and family relationship, uh, and they are at risk of getting bullied or being bullied. Children with ADHD may develop significant conduct problems and antisocial behavior. They may affect they may affect emotional they may get affected emotionally, um, and they have low self-esteem, and overall all these implications leads to poor quality of life. Strategies for management of behavior needs in early childhood and classroom settings. Um, Sorry, I just skipped one slide. So, the early intervention and teaching strategies for children with ADHD. It is helpful for the entire class to teach strategies that aid students with ADHD. Structured environment. Um, Providing students with clear instructions on how to carry out specific routines, and if possible, post your daily or weekly schedules on a wall or bulletin boards, or if not, just post more pictures that they can take ideas from. Um, as a result, student knows what to expect, which provide them with a great sense of security. In turn, they learn how to regulate themselves and develop good habits on their own. Clear rules and expectations. One way to prevent behavior problem is by reinforcing program rules and expected behavior, like routines and schedules. It helps to post them in a place that is easy for students to review when needed. Can also offer praises or rewards for good behavior, which is a great way to reinforce expectations. Physical activity. A recent study showed regular activity decreases the symptoms of ADHD and improves cognitive function in children. Parents' involvement. In Parents who are involved in their child's education have a positive impact on their success as a student. Not surprising, research shows that parents um, involvement is a key to improving academic performance and social skills of children with ADHD. In order to engage with parents in a program, communicate with them regularly, um, talk about their child's behavior and performance, share their progress, take their feedback on what the child is doing at home. Um, this way, it will better help understand teachers with child's strengths and weaknesses, as well as provide accountability for students. In return, students will express great success in your program or childcare center. Strategies for management of behavior needs in early childhood and classroom settings. Define rules. There should be a set of rules and routines set for children so that they know what they have to do and what sort of behavior is expected from them. Giving immediate rewards and consequences. Children should be children who are suffering from ADHD should be rewarded immediately for good behavior if they have been doing the task you have been told nicely, or given have been should be disciplined if not doing the work properly. Uh, you should provide the child with frequent feedbacks, giving positive comments such as "Good job, well done." Be consistent. Keep talking to the child. Um, don't don't talk to a child like one day and then not talk to him for other day. Be consistent in your conversation and be regular. Establish routines. Create checklists. Create checklists for the child. You can give a checklist to the child and say, "This is the breakfast time. When he's done, he can just pick it up. Now it's outdoor time, playtime. He can pick it up. Nap time." So that's how you can help a child. Plan for problems. So if a child has some behavior problems, and if an educator already have a plan for some sort of behavioral problems, for such as a child happens to shout a lot, and if given a specific toy, he might calm down. So such plan should be already in educator's mind. Focus on positives. So children suffering from ADHD have a lot of behavior problems. So instead of focusing on their negatives, focus on their positives so that it gives you the chance to uh, engage with them more and help the child to develop. Type of environment learning experience suited for children with ADHD. So, the environment that an educator can create in a childcare is a physical environment, first of all, the overall design and the structure, the shape, such the learning center, equipments, and furniture should be according to the child suffering with ADHD. It shouldn't be too much cluttered, not too much confusing. Everyone should be make the structure easy and simple for the child. Social environment. So um, the child should the child should be made introduced to all the students. All the children in the class should know what sort of problem he has, and everybody should know the appropriate way of behaving with the child. Well, we can't expect too much from the children, but children tend to know if they are told. Um, Temporal environment, the timing, the series, and the period of long day routine, as well as the activities, should be set according to the child's need with ADHD. Like the child should the activity shouldn't be too long, like for 1 hour or 2 hours. Should be just for like half an hour, and so that the child can get updated and be uh, be attentive. That's it for today. Thank you so much. This is my reference list if you guys want to refer it to. Thank you so much. Have a good day.